Today there is a very important subject. The subject for today is the ossifying fibrous lesions. 3 types of ossifying fibrous lesions there is in this lecture. The first is ossifying fibroma. Second, cemento osseous lesion. Or the cemento osseous fibroma. And the third is the ossifying fibroma. Again, I will repeat. Ossifying fibroma, cemento osseous lesion, which is the most prominent type and the most frequent type that exists in the ossifying lesions, or in the fibrous ossifying lesions. The third is that what we will talk about right away is called the ossifying fibroma. What is the ossifying fibroma? There is monostotic, poliostatic, and there is the Albright Syndrome, which is a type of poliostatic. All types of ossifying fibroma. The first one involving one bone and at the maxillary, affecting males and females at the same ratio, and especially adults are affected with this disease. The poliostatic fibrous dysplasia is another type. This one is involving multiple bones, causing pain and discomfort to the patient, and also deformity of the bone. The poliostatic affecting the mandible, with the young patient are mostly affected. And this disease must be treated if it's involving a large side and causing cosmetic and functional problems. Now we will talk about the third type of poliostatic fibrous dysplasia, called the Albright Syndrome. One type of ossifying fibrous dysplasia, especially fibrous lesions or fibrous dysplasia, and this one occurs in the female more than males, at the mandible, causing or associated with endocrine anomalies, and causing pigmentation in the skin. All the 3 types that we talk about yet are part of the fibrous dysplasia, and these, all the 3, are do not require treatment if the lesion is small, but if it's larger, causing difficulties in function or cosmetic, there is a surgical contouring procedure is involved and must be applied to the patient. Microscopically can be differentiated also as the last one, the fibrous dysplasia, called the poliostatic Albright Syndrome, having a different shape of bone-like structure, trabecular, irregular, resembling Chinese letters. In general, all the ossifying fibrous dysplasia or lesions replacing the bone with a fibrous trauma. As the fibrous dysplasia is well known reason and etiological factors for its cause, called the genetic protein involvement, and that's why the ossifying fibroma is produced. Next, type of cementome called cemento osseous dysplasia. This one is a part of fibrous or ossifying bone lesions. One type of bone lesions or ossifying Fibro Osseous lesions. We call Fibro Osseous lesions. There are three types of cementosis dysplasia: focal, periapical, and fluoride, all affecting females and causing different problems. As this one, the focal one is the most frequent, followed by the periapical, less frequent than the fluoride. The first two affecting the mandible, as the first one affecting the posterior focal mandible. The second one, called the periapical, affecting the anterior mandible. And the third one, that's called the fluoride, cementosseous dysplasia, affecting both mandible and maxillary at a similar rate of or ratio. There is a histological difference between each one. At the beginning, there is a radiolucency, not like the ground glass radiolucency that appears at the monostotic fibrous dysplasia, but this one is radiolucent defined area that becomes radiopaque within time. We don't have to talk much about this lesion. It's very well known, cementosseous dysplasia. Ossifying fibroma is the last type of osseous or the fibrous fibroosseous lesions, ossifying fibroma. Two types: ossifying fibroma normal and ossifying fibroma juvenile or aggressive. The normal affecting the maxillary, females, black females, mostly, just like the cementosseous lesions or dysplasias. And this one, the previous one do not have a reoccurrent rate most of the time, the cementosseous dysplasia, and it does not have to be removed surgically because it is asymptomatic and do not cause malignancy. The one that we are talking about now, the osseous fibroma, also does not require surgical removal in most cases. But when we talk about the second type of ossifying fibroma, called juvenile or the extreme or aggressive ossifying fibroma, this one requires surgical removal, having a recurrent rate 30 to 50%. And all these fibrous dysplasia, fibrous, not the fibrous, the ossifying fibroma, all are neoplastic. There is no change in malignancy most of the time in these types of lesions. Of course, ossifying fibroma affecting the maxillary males, causing them to have a very difficult situation to the patient. Thank you for listening to this lecture, and this was a brief discussion or a brief enumeration about the types of fibro osseous lesions.